light or no?
No, it's probably better. Just to leave it. Okay. So I was asked to go over allergy injections. I know a lot of people are nervous about doing it. Hopefully, after we go over this tonight, it will help. But I wanted to explain just real quickly why we even do them in the first place. So, just every day in life we're all exposed to allergens, and just in the air, on surfaces, all that kind of stuff. Some people don't have a problem with them, and some do. And your system just kind of goes a little crazy sometimes if you do have a problem with an allergen, cat. Oh my God, I hate cats. So what happens? So your histamines just kick in and just goes crazy to get to that problem that's affecting you. Whether it goes to your nose, start getting an itchy nose, the throat, red, puffy, or watery eyes, coughing, sneezing, stuffiness, headaches, all that kind of fun stuff. We all know what we're talking about, some more severe than others. Or a rash, if it's more of a, doesn't have to be something that touches you, it could still be something you breathe in and can cause this. Quite familiar with this one. Or it can go to your lungs, affect your breathing system, and we have asthma. You can see the normal bronchioles down there, nice big and open. One up top, you have the inflammation, you start mucus, and all you people in the San Diego clinic, you just see everyone coming in coughing, you have trouble breathing. So then what do we do about it? So we start popping all kinds of pills. Oh my God, where's my Benadryl? Where's my eye drops? All that fun stuff. If it's really bad, you come to the doctor, might need to have some treatment, more severe medication instead of just over-the-counter stuff. It's really bad, you may end up in the ER, you're getting epinephrine, you're getting all kinds of steroids, fun stuff like that. Nebulizer is always fun, we're all familiar with that. By the way, if you do use a nebulizer on a patient, little side note here, make sure you charge for it, because we're missing that a lot. So you have to go into orders, and it's the inhalation treatment, and then there's also either the albuterol or we don't do Zopanex anymore, but ibuprofen. We're missing a lot of those. So if you do one on a patient, make sure you go in there and do that, or at least make sure your provider did. If they didn't, then you put it in. Aye. So it might be better to try to prevent these allergies in the first place, and one of the ways most people do it is the first thing would just be just daily antihistamines, temporary relief. If you have mild allergies, this usually works just fine. A little bit more severe, maybe the Singulair, that is a prescription that the provider has to give you, but that's one way, and it works great for most people, for a lot of people. Second would be more of a, I was almost not going to put this in, but there's a reason for it. We have a seasonal allergy shot, and the reason I say allergy shot is because this really technically is not an allergy shot, but we do have patients that come in and say, you guys do allergy shots here? And they're talking about this. It's just Kenalog or another form of steroid, and it will hold on for a good maybe 3 months, so they know when it's during their peak season, they just want to come in and get a shot once a year and not deal with the pills and all that kind of stuff. Not the best way to treat allergies, but some of our providers will do it. Or you can also use this as a rescue med too. If it's already happening, sometimes they'll use that. Not the best choice though. Third way would be immunotherapy, aka the true allergy shots. And this is what we're talking about tonight. What immunotherapy does is it trains your body to stop reacting to the allergens. So instead of when you're around that horrible kitty cat, now after having treatment, your body's now going, oh, I'm a cute little kitty. So it's not an issue anymore. It's a good thing. So what they do is, for those who aren't familiar with it, you go to the allergy doctor, they do this testing. It could be on the back, on the arms, most of the time on the arms, but if there's a ton of things they're testing for and you need a bigger area, you might do the back. So just tons of serums. They just test you. It might just be environmental type things. If you have food concerns, they might do a food panel. There's several different panels they can do. They find out what it is you're allergic to and how severe, and from that they create serum. And this is where we come in. We have lots of patients who go to the allergy doctor and they do this, but their office is inconvenient. We've got some that are up in Auburn and Renton. I think probably the bulk of our patients are from Andrade Brown and Dr. Song's office. They're really close, but they have really bizarre hours. They're just not very convenient. They'll be a half day Monday in the morning, but Thursday it's afternoon, half day. Some days it's all day. Otherwise you gotta go to the Lakewood office, or it's really weird. So they want to bring their stuff to us because we're always open. And that's how we end up doing this. So, going to go over how we actually, the right way to do it. So I'm just going to go down the list here. Before you ever draw anything up, you always want to make sure that there is a provider in the building, because we cannot do it if there isn't. And we need to know that they're going to be there the entire length of time the patient's going to be there, which is typically about 30 minutes, and it could be more depending on the reaction. So don't even start it if it's for closing in 10 minutes. You need to get all of our allergy patients will have a paper chart in addition to their EMR chart from their allergy clinic. So you need both of those. We always want to, like anything else, ask the patient to verify their name and date of birth, obviously. And we need to review the reactions and the last date given to see if the patient's ready to even increase or even have anything that day. Because you might look in the chart and see that they had no problem last time, or they had a little bit of reaction, but it was no big deal. We don't want to assume that's okay to go ahead and move on up. We still want to ask them, because they could come back and say, that little bump that I had got huge when I left. My whole arm was swollen. I mean, we need to know that, because we're not going to go ahead and proceed. So we always want to ask that first. So that's why I say don't ever draw it up until we have all our information first. Ask the patient if they had any problem after last visit. Like I said, the delayed reaction to happen if they leave, and you want to document that if it did happen. And anything you're putting in the paper chart, we're also putting in our chart, so it matches up. So you would explain why we're doing what we're doing. Patient states that got to the size of a $100, whatever. Just put in what they say. And we also want to know how they're feeling today. Some people will come in and they're really sick, but they're thinking they're not allowed to miss their allergy shot. They've got a fever. They have a rash from something else, or just things. It's not a good time. It's really severe allergy symptoms. It's probably not a good time to have an allergy shot, because they're already reacting to tons of stuff in the air. It's just we're just adding more to it when we're giving them something they're allergic to. So just check that first. Most people, if they're that sick, they're not going to come in. But so once we've determined everything's cool, we're going to go for it. The actual steps of doing it would just, like any other shot, you're going to use the alcohol swabs, clean the vial or vials in the arms. I like to get their arms all cleaned and let those dry while I'm drawing it up, because it just stings less and not as likely to have a reaction if you don't have fresh, wet alcohol on there to give it. Use the tuberculin or allergy syringes. I don't know whoever does ordering at each of your places. They come in little trays like this. These allergist tray syringes they're perfect. You don't need to switch any needles. I don't know if people are doing that. You just leave the same one on there. You draw up and give with the same thing, and they're perfect for measuring all that. So best ones to use. And you will draw up according to the allergy office's schedule and have a second person verify that it is the correct dose. We've seen where somebody was supposed to get 0.05 and somebody drew up 0.5. And the point of allergy shots and the serum is to have minute amount. It gradually increases. We have super weak serum to begin with, and when we increase that, the highest amount they're going to get is 0.5. Once they get past that vial, they're going to go to the next vial, which is a more concentrated version. So you can see the progression. It gradually, very gradually, it takes like 52 shots or something like that to get to their maintenance dose. So we don't want to rush anything, or we're going to have a bad reaction, most likely. So we want to make sure it's correct, have someone else take a peek at it, and that's really what you drew up, and that's what it was supposed to be. And I'm going to I'll go over more on how to figure out what they need in a minute. If we just do it, it's a sub-Q shot, like any other sub-Q shot, 45-degree angle, and I always go at a downward angle because the stuff is like syrup, and it's not going in very deep. So
in my mind, I figure if it's going down, it's less likely going to come back up and out. But when it's down, I find more oozing that way. If you've got some on the outside that oozes back out, you are more likely to see a reaction, just because it's not only in their skin, but now it's all over it too. So I like to just try anything I can to keep it from oozing. And as far as where you get it, you know, we typically do our sub-Q shots here. Allergy shots at the clinics, they'll do them all over the place. You can do it on the side and the front too if they have enough there to do it. So that's okay. You want to. When people are getting allergy shots for years and you keep doing it in the same place, it starts to get pretty tough. You can actually feel lumps in there, and you can feel it when you're putting it in. So spread the love. Spread it around. And then you have to have the patient wait in the lobby for the amount of time required by the allergy office. Nowadays, they're almost all 30 minutes. They've gone from 15 to 20, now it's 30. That's what I see the most of anyway. And make sure you tell the patient, let the front office know, or if they're close enough, they can come straight back, whatever. If they're having any symptoms that are, you know, the obvious shortness of breath, swelling, if their throat's swelling up, flushing, they're just not feeling right, we should bring them back so we can make sure everything's okay and have a brighter look at them if we need to. And we don't ever want to have them sitting in an exam room by themselves. A lot of people don't want to go sit out in the lobby, but we want them where people are going to see them in case something does happen. Some people will want to sit in the office, in an exam room. We never want them by themselves. What if they go down? We don't know it. So we've got one patient, little girl out at Sunrise, but her mom's with her, and they would rather sit in the exam room, but we know mom's right there and she's going to come get us if something happens. So if they've got somebody with them, that's fine. But do you want to take a room for that long? So anyway. So patient's gone, we can start documenting because you need to put the time that you gave the shot, and then you're going to, when they come back in, you're going to put more information. So you can go ahead and start that at that time. The time of injections, the amount given, and which arm. And you just put the lab visit in the EMR for allergy shots, and make sure that in the summary title that you say it's allergy shots, allergy injections, whatever. Don't just leave it as lab visit. And that goes for anything. Blood draw, they're coming in for a TDAP, if they're coming in for whatever, please put in what they're coming in for. Don't just leave lab visit. That's simple. You need to know why they're coming in. So in the upper right corner is where it says allergy shots. It's obvious where to do it. Allergy shot 1 and 2. Some people are only getting 1, some are getting 2. Some people with a lot of allergies, they can't fit them all in these vials. They can be 3 and 4, but I have not seen it at Soundtime Medicine.
We have one that has 5.
Are you serious?
Yeah, Bonnie Lake.
Almost all of mine are 3 or more.
Holy
I
cow.
have 1 or 2 that are
Well,
one
up
shot,
there,
2
there's
shots.
a lot more stuff to be allergic to up in the woods, you know.
Yeah, we always got a lot of allergy shots.
That's crazy.
So.
Yeah, I used to see it when I worked in the allergy office, but I haven't seen it here. Fun with that. So, where are you guys documenting all those? Just typing it in?
Type it in, yeah.
Yeah, manually, every time.
Have fun with that.
Yeah, we need
I suppose
to
we could, you know,
Add more.
I am going to be talking, yeah, Abby, this is what I was talking about earlier. We'll probably be chatting about, we might even want a whole tab just for allergy shots because of stuff like that.
Here, here.
So, you'll,
Love you.
in the near future. And to correct the spelling and stuff on these.
I didn't make that.
Immediately.
I just want to put that out there right now. That I didn't do it.
I know you didn't. That's been there forever.
Let's throw that out there.
Okay. And so currently our form does not match everything that the paper chart does. So we'll be probably revamping this. And then make sure you go into the orders, just like everything else. Put the orders in for it. These are allergy shots.
Not injection fees.
If they're going to have, yeah, definitely not, this is completely different than a vaccine. It's different than the therapeutic or, what you call it, shot, injection. Right here, injection, therapeutic, or diagnostic subcutaneous. It's only the allergy shot. And if you're just giving them 1, you obviously use the one that says 1. If you're giving them 2 or 3, then you will also click allergy shot. Think of it as first and second, not 1 or 2. So you're getting 2 shots, you're going to get both of those. You're getting 3 or 4, again, both of those. You should go, if If it's more than 2, you should go into the units, yeah, what you call it, and say how many shots they're getting, that they are getting, because they're going to be charged more. And the diagnosis is always going to be either like an environmental allergy or there's allergic rhinitis, anything that has to do with allergies. If there are more, put them all in there. So, any questions on that part? Okay, 30 minutes is up. They come in. This is what we're looking at, the reactions. So I want to just, a lot of people get worried about the reaction part, and it's really not as bad as you think. We expect something. I mean, it's okay if there's nothing there, but it's normal to have something happen because they're allergic to this stuff. Mosquito bite is pretty typical. That's the size that would be really common to expect. So we're measuring the size of the induration, not the redness. I can't stress that enough. So you look at the first one here, you can see the size of the induration. That's not even counted as a reaction. It's nothing. The redness doesn't matter. That redness could be a lot bigger and it's still not an issue. We still just want to measure the induration. The one in the upper right corner, that one, it's hard to tell by the picture. If that's just redness, then we're not that worried about it, believe it or not. That one to me, though, looks like, since it's such a definite edge, it probably is an induration. So that's something you need to feel it, not just look at it. And if that's the case, you need to measure it and put in there how big that is. If that thing is that big and it's really an induration, then we're going to probably be calling the doctor's office. But, and then this one here, I don't know if you can see it that well in the picture, but it's pretty big. Yeah. The whole size, but that's what we're measuring. And you can use, I don't know, there's different things to use, but these come in real handy to measure. Same thing that we use measuring the TB test, that sort of thing. Then we have the satellites. I don't know if any of you have seen those before. That's a little more concerning. There's multiple wheels, and that's not good. It's not like serious, oh my God, call a doctor. It's just, they're not going anywhere. They're going to stay another 30 minutes because we want to, this could be the beginning of a systemic reaction. So we want to make sure it doesn't get any worse. We should be giving them some sort of antihistamine while they're there and have them wait another 30 minutes and then check it again. Usually what they'll do is just kind of spread out and flatten out a little bit, and they usually become one big one, or they haven't, if there's not any more, then they're good to go. And as long as they feel okay, you always want to ask how they're feeling. Any other issues, if they're good to go, then it's fine. And this is all stuff we have to document in both charts. And then, well, one other thing. If you just glance at someone's arm and you don't see anything that might be a little bit red, I always take their arm and kind of just pull the skin tight, because then, oh, there you go, there's 3 of them there. You didn't see them before. If you pull it tight, you'll see the white induration, or where you, at least the one where you gave the shot. So always check that. Never just glance. You want to make sure there's really nothing there. So now we've done all this, and this is what the chart's going to look like. This is from Allergy and Asthma Specialty Service. That's Andrade and Brown and Song's office. Their forms can look so confusing. There's so much information. Not this particular one, but on the back of this sheet. And this is, you guys should all have a copy of all of these. If you don't, I have some, and there's some in the back too. This is the front sheet. That's the back of the sheet. So I'll start at the front. So you just need to follow right along with it. It tells you exactly what they want. The date, the vial number, because they will have, if they're on their, they've gotten to their maintenance dose, they're only going to have the 1 vial and it's vial number 5, and that's the only one they're ever going to have from now on. If they're still building, you're going to get sets of vials, and they're different colors and they have different concentrations, and again, like I said earlier, they're gradually increasing in strength. So we need to make sure we're going in the right order. So you put the vial number, the solution expiration date, you need to read it off the vial, and I caution you, don't ever just write what the person above you wrote. Make sure you just ignore that and take it right from the vial. because I've even seen it in the allergy office where someone started doing that, 3 people in a row did it, and it wasn't correct, and almost got their heads cut off. It was a pretty strict office over there, but it's very important that you have this information right, and we need to do it in their chart because they might ask us to fax it over there. So if they see this and then we're not doing it right, they're, well, I don't know if they'll probably say you can't get shots there anymore, lady, but whatever. Don't know what they do, but you're right. This one particularly says, on the concentration, it just says concentration because they are at their, it's concentrate. When they're at their 5th vial, that's what they name theirs. It says concentrate. The other ones would say 1 to 10,000 or 1 to 1,000, 1 part per thousand. So that it's the strength, how strong, how many particles, basically, the ratio of serum in there. And I think it goes to 1 to 1,000, 1 to 100, and then concentrate is 1 to 1 or something like that. So, and then the dose, that's that column, and again, there, I'll show you on the next page, you'll see on the next page how we come up with that. Always put which side you're doing it on. If they're only getting 1 shot, they have 1 vial, getting 1 shot, alternate them each time they come in, so you'll have left, right, left, right, left, right. If they are getting 2 separate ones, always keep them on the same side. Don't alternate them. Because if for some reason all of a sudden they had this bad reaction, well, was it just because you switched sides that time and you hadn't before, or is it really a true reaction? You just never know. So I know at that office they want you to keep them on the same side. And that's why, you see up at the top, there's an R, this like right arm. Someone had written that on there because when these papers first came, they have theirs set up where their little red cap vial is the left arm and the other one's the right arm. So we make sure we write it on the paper. So each time they come in, you know which one's going to go in which arm. So there's no question. And the time in, and that's what time you gave the shots. The time out is when they're done. And then you initial, and then you have the reaction on the end. Slightly red, whatever it was. That one up top, I would probably just say it was slightly red. You can measure that if you want to. They don't think you can consider that a reaction, but if you want to put the actual size every time, that's fine. You'll see a lot of slightly, they'll just be red with no bump at all, so that's why people use that one. So this is on the back side of that sheet, and here's what I was talking about. Here, you can see up top the recommended treatment schedule, and it has the strengths of them. Oh, it's like 1 in a million and 1 in 100,000, 1 in 10,000. So that's how weak it is when you first start that serum. You don't really need to worry about what's at the top. With all of this information, the most important thing is looking at the schedule of doses, number 2. If they're not already at their maintenance and we are building, you just need to know whatever vial number they're in tells you what the next dose is. If everything was fine and they need their next dose, they get to move up to the next dose, it tells you what that next dose is. Does that make sense? In the first,
yes.
In these columns. Once they get, let's say they get through that first vial, vial 1 and 2 are both using that first column, that's Schedule A. We've gotten through those first 2 vials. The 3rd vial, you're going to go to Schedule B. So you can, it's stretched out a little bit more. That's just how they came up with it. You never get more than 0.5 from any vial. Once they get to 0.5 and they did fine with it, then you're going to go to vial 4 is the same thing. Then vial 5 is the concentrate. You'll notice on this lady's, she's never going to get to 0.5 on her maintenance because she had so many reactions. She's had some bad ones, kind of scary ones. So she's been sent back to the allergy office and they have reevaluated a couple of times and said, you know what, this is as high as she's going to make it. So she'll never go past 0.3. So I went ahead and crossed that off so nobody ever makes a mistake to go past that. So the other thing is number 3, management of shot reactions. It tells you right on there what you need to do. So you don't have to know all this. It's right there, and it'll just tell you. And as you can see here, a reaction of 50 millimeters, okay, that's pretty dang big. They're not really concerned about doing something different unless it's that big. So just so you guys know, a little nickel size induration is okay. They'd still go ahead and have you move up to the next dose next time.
So all you gotta do is look at that. It takes all the way up to 50 millimeters to just to repeat the last dose. We're just not gonna increase next time. And if you're the one who sees that, like, okay, well, they have that, I go ahead and go to that next line on the, when you're writing that down, on the next line in the dose amount, the dose, then put, let's say she had 0.30 and had that big of a reaction, I right away for next time go and put that on there. I'll put 0.30 in that column again so people, if someone else didn't catch it, we already know that's what they're getting. They're not going to get more than that, so I go ahead and fill it in. Or, if it's worse, the satellites I was talking about, hide separate from the shot site, you're going to cut back to prior dose tolerated. So if the one before that was fine, then do that dose again. So you see what I'm saying? Like, you don't really have to know all this stuff. It's all right here for you. You just need to kind of look through it and see. The systemic reaction, obviously that's a really bad one. We're sending them back. We're going to take care of it at the moment. We're going to, that's when we get the doctor involved, and we're going to treat the patient the way the doctor wants to, and they have to go back to the allergy office, get reevaluated, and with new instructions. So we will not give them any more shots until we get new instructions from that doctor's office. So,
Hey, Joan.
yeah.
Also mention about what happens when they're not on time for their shots.
Yeah, that's the next part down, number 4, management of missed doses. And that, sometimes you have to do some math if they're really late. So these will explain right on there during the building phase, or if they're in the maintenance phase. You just have to look at it. It'll tell you how many days to count from their last shot or from the time they were due, depending on what stage they're at. So again, you really just need to read it. I wish there was just this black and white simple thing and I would just type it out for you step by step how to do it, but you have to do it by what each office says because they're not all the same. So again, you just have to read it. And I'll show you real quick, this is a different office. There's a little more similar on their, on that form, the record, but their instructions are super simple. See, there's just 20 minutes, they cost up to 30. So anyway, they've got nickel size, quarter size, and they tell you for each of those. Look at it, they'll say what you need to do. Okay, if it's that big, you need to reduce it. If it's that big, you need to call us. So just do what it says. There's one more, you guys have one more sheet too, I didn't get it on here, that's from the same office, and it just has more instructions. Their dosing. So you'll just look at that, and this is what's in their folder in the chart. So, yeah, that's it. I think that's it. Any questions? You guys can call me anytime you want. I think most of the supervisors know these pretty well, so if you have any questions. Have a second person look it over.